Hello, my name is Zoe Diana Draelos. I'm a research and clinical dermatologist in High Point, North Carolina with Dermatology Consulting Services. Well, the Malassezia Folliculitis paper was really a review paper looking at the literature because Google searches for Malassezia-induced folliculitis have skyrocketed because many people are concerned that they could have Malassezia folliculitis instead of acne. So the purpose of this paper was supposed to highlight what the unique attributes are of Malassezia folliculitis, how it's distinct from acne, and how treatment needs to be separate for both conditions. Well, to the uneducated eye, Malassezia folliculitis and acne look exactly alike, but the dermatologist can easily separate this condition. First of all, Malassezia folliculitis has a monotonous sort of pustular formation over the face, and it can involve other body areas as well, whereas acne is a mixture of cysts, open comedones, closed comedones, inflammatory lesion, and pustules, and they're not monomorphous. They are monomorphous in Malassezia folliculitis, but acne has many different lesions with many different types of presentations. So acne is caused by organism C. acnes, which is a bacteria. Malassezia folliculitis is caused by Malassezia, which used to be called Pittosporum, but is now termed Malassezia, which is a fungus. So when you're treating acne, right, you're going to use antibacterials, antibiotics. But when you're treating fungal folliculitis, you're going to be using antifungals topically or orally. Well, with Malassezia folliculitis, one thing you're looking for is lesions along the hairline, because most of the Malassezia on the head itself resides in the scalp. And remember that Malassezia is one of the causes of seborrheic dermatitis, or the consumer terminology of dandruff. Acne basically tends to present with open comedones and closed comedones. Those are not part of Malassezia folliculitis. Acne also can present with nodules and cysts. Those are not seen in Malassezia folliculitis. And the pustules are more polymorphous in their presentation in acne, whereas they're very monomorphous in their presentation with Malassezia folliculitis. So those are the key distinguishing factors diagnostically that the dermatologist should be looking for. But if you have very monomorphous acne that's not getting better on antibiotics, you really should consider Malassezia folliculitis in the differential diagnosis. Well, one thing is if you suspect that there might be Malassezia folliculitis, it's very easy to use a topical antifungal. Malassezia folliculitis is susceptible to clotrimazole, some of the older antifungals, and it's easy to throw that into the mixture. So if acne isn't going away, it's not responding, there's still a lot of pustular involvement, consider Malassezia folliculitis as a treatment option.